This podcast is produced by OnPod, a video content studio near you.
Hi everybody, welcome back to the podcast. Today we are here with Ayman Agour, who is a licensed pharmacist in Ontario. Thank you so much for being here today with us.
Thank you for having me.
Of course, yeah. So what's one common misconception people have about what pharmacists really do beyond dispensing medications?
It's a very good question. I'd say a lot of people tend to think that it's just giving pills per se, where you come to the pharmacy and you give your prescription and we just hand you pills. But the big misconception is mostly that pharmacists, obviously, it's our job, it's what we do. There's a lot more than just handing over pills. So we clinically go over the medication, make sure that one, it's appropriate for you, and two, it's safe for you. So there's a lot of things that we do beyond just giving pills, and obviously we need to make sure that the pill that's in the bottle is the correct medication. And then we're also there to answer your questions, whether it's about side effects or how long you'll be on a medication like this. So, like I said, there's a lot more to just giving pills, which is truly a big misconception in a day-to-day work of a pharmacist.
Right. So is the doctor responsible for those side effects or are you responsible? Like the
Um,
doctor has your background, but
yeah.
do you go more in depth based on the patient?
So at the end of the day, the doctor did prescribe the medication. So you assume that the patient and the doctor had already spoke about it. So they should have a general idea as to why they're taking the medication.
Mhm.
But a lot of the times from what I've seen is the patient still has certain questions, whether it's about side effects, should I take this with food? What time of the day is the best to take this? So all those little details and sometimes big details are generally answered by the pharmacist.
Yeah, especially when they have different specialists that they're going to see as well, right? A lot of the
Exactly.
time they
Yeah.
have to go to 5 different people for 5 different parts of the body that they're treating and they don't
Yeah.
confer with the doctor. So they
Yeah.
have
Yeah.
to come to you and ask for those
Exactly.
specifics, right?
Exactly.
Okay, so you also create engaging social media content about health and medicine. So how do you translate complex clinical research into information the public can actually understand?
So you said it. It's complex, right? Like the
Yeah.
clinical trials are some of them are very hard to read, whether it's understanding the results or the type of patients they use in the trials. So basically, what I like to do is at the end of the day, a patient's not going to go read a trial, or if they do, they won't really understand it. So they just want to know, hey, does this work, or is this medication in the trial suitable for me? So that's where my job comes in. And I like to break it down kind of in, I'd say, 3 steps, where one, I truly understand the literature in terms. So obviously in school, that's what we did. Like we did a lot of understanding of clinical trials. So I'd say it's in my expertise to do something like that. So first thing, I'll truly understand it, like I said. Second thing is I'll tend to remove all the medical jargon because you don't want to be using words, the big words, fancy words that people don't really understand, right?
Mhm.
And then finally, once I do that, that's where me and my team will look into, okay, how are we going to make this enjoyable for our viewers? How are we going to make this, I'd like to say fun. So just in a way where people will really enjoy the content and not get bored by medical content.
Okay, so do you actually have to help people interpret other information that they see online as well? Like, do they come to you with questions
So
about?
yeah, so one of the pharmacists, usually the pharmacist, I'd say, is like the last line of the healthcare. So you go, you see a doctor or a specialist, and then you have your talk regarding your health, and then the last person who you're gonna see, whether it's to give the medication or whether you have questions, is generally the pharmacist. And we're the most accessible people, I'd say, from the healthcare field. So that's where it comes into play, where we need to be able to really give the proper knowledge because, like I said, we're the last person you'll talk to before you really take that step to take your medication, for example.
Mhm. I know for myself, a lot of time, if I go to see the pharmacist and they give me a pill or something like that,
Mhm.
I just kind of nod and take the pill. Like I
Yeah,
know you have to give the whole
yeah.
spiel of what the side effects are and
Hmm.
when to take what, and
Hmm.
wear sunscreen if you take Accutane or whatever like
Yeah.
that. Is there any questions that you urge a client to ask their pharmacist if they're not fully inclined to do that
Uh,
for any pill that they're going to be taking?
Generally, what I like to do when I'm consulting a patient, like for example, usually whenever someone is taking medication for the first time, that's like a flag for me. Like, okay, like this person hasn't taken this before. So generally, I'll always give them like a consult. So this is what this medication is for. And then I'll say that it's supposed to be taken with or without food, what time of the day. And then I make sure to see if they're on any other meds, because sometimes some patients will be on medications from another pharmacy, for say, or they'll be taking over the counter medication that interacts with this. So I generally like to get like a full overview of the patient and just kind of like a mini interview. And from there, I can assess, okay, this patient is one, suitable to take it, and two, they generally understand what they're taking and how they're taking it.
Okay, so in reality, like the patient doesn't really have to come and ask questions. You know all the proper things to ask
Yes.
before they take it.
Of course, exactly. Like I said, like generally when we're doing the final check, whether it's like a product check, so like I'm checking just like the item, or I'm doing clinical verification, I'll get prompted that this is a first time dispense for this patient. So
Mhm.
immediately I'll know when this patient comes to pick up. And I'm pretty sure at most pharmacies we have at the pickup screen like where it says first time dispense, or there'll be like an icon. So the usually the assistant will alert the pharmacist like, oh, this is the patient's first time taking this. Do you want to talk to them? And I'll always say yes. So
For sure. Yeah, that's interesting. I didn't
yeah.
know that. Can you share your perspective on large pharmacy chains versus like a local independent pharmacy?
Yeah, so obviously, as you know, there's like Shoppers, Drug Mart, Rexall. Those are the bigger guys, and then you have the small business owners, which are both great. I think they both play a very vital role in healthcare these days. I think the big difference would be one, accessibility. So for say Shoppers are open, I think from 8 a.m. to 10 p.m., whereas a small business will probably open from like 10 to 5, 9 to 6, whatever it is. So in terms of accessibility, you have your pros and cons. But in terms of, I'd say, special like medication tailored to you, or like service tailored to you, that's where the smaller guys really excel, because at Shoppers you'll see 300, 400, 500 prescriptions a day.
Mhm.
You don't have that time to really sit down with a patient and really have a look into their file, have a nice chat, maybe sometime even like a nice conversation.
Mhm.
Um, that's the big difference. So if you're looking for something very tailored to you, I would focus more into like the small pharmacies.
Mhm. Are there any other certifications that a pharmacist can get to maybe enhance their small business if they were a pharmacist? Is there anything
So
that would level them up in?
for sure, there's a lot actually. So generally, whether you're working at Shoppers or not, or a small business, you can get a certified diabetes education. So you'll be a CDE, which is a certified diabetic educator. So that's where you'll really be more focused into diabetes. So you'll be more knowledgeable in point of care testing for blood sugar levels, for example. That's one of them. There's also specialty services in pharmacy. It's called compounding.
Mhm.
So in pharmacy, sometimes doctors will prescribe creams that are not commercially available for say, where you have to actually make them. So there's enhanced training you can do, and you can actually open a compounding pharmacy, which allows to create certain medications, like I said, that are not commercially available.
Mhm.
And that really helps, because sometimes some patients won't get relief from the typical commercial cream that are available nowadays. But with these things, we can mix certain powders and creams, which will allow for that result that the patient and the doctor are looking for.
Do you find that these are more readily available at like a smaller or local pharmacy than
Uh,
the big ones or?
Nowadays, yes,
Okay.
compounding. So to my knowledge, I'm pretty sure like the bigger like industry pharmacies, they don't do compounding as much. So that gives like the smaller like local businesses a bigger opportunity to focus on that, and kind of just really dive into that to get the patient what they want.
If you can tell, I'm a little bit more biased towards small businesses and
Yeah, I
supporting
mean, I
people,
I
so
I, I support small businesses always. Like I said, if you're looking for something very tailored to you, and you're really looking to build a relation with a pharmacist, because the pharmacist is kind of like your best friend, because you're sharing all of this personal information with them,
yeah.
and it's nice to know that you're coming to see the same person every day. Whereas if you're going to a bigger pharmacy, sometimes it won't be the same person. But again, like they both have their pros and cons. Like if I'm getting discharged from the hospital at like 9 p.m., I know that Shoppers Drug Mart is open, or I'm not sure if Rexall opens till 10, but
Mm,
in terms of accessibility and more product selection too,
mm.
because these bigger pharmacies have a lot of patients on different meds, so they'll carry more meds in stock compared to the smaller businesses.
But on the other hand, if your pharmacist is local and they are a little bit more knowledgeable about your
Hmm.
file, then they can create those compounds to make you feel
A
your
hundred
best.
percent, 100%. Like I said, I support local businesses. I think, it's like it's great. So
Yeah, we're just having a good little debate here.
yeah.
So aside from all the technical stuff, what are the supplements or health topics you think people should understand better right now?
Um, so like I said, the pharmacist is like the last line before you take something. So it's important that pharmacists, so our job, our specialty is that we're there to, in a way, debunk certain things because online, especially nowadays, you'll see these things on peptides, for example. I'm sure you've heard of all these things on whether it's on Instagram, TikTok, where take this and you'll get that, which,
Mhm.
as a pharmacist, I see this, I'm like, whoa, like that's, what about like the side effects? Are you even supposed to take this? Where are they even sourcing a medication like this from?
Mhm.
So that's in terms of like whether it's supplements or any health product, that's very important to know, which is why we have pharmacists. In terms of certain things now that I always generally recommend, obviously, always speak to like a doctor or someone like myself, a pharmacist, who can tell you whether you should be taking this because you can be on a lot of meds that don't allow you to take like this supplement, for example.
Mhm.
So it's very important that you speak to someone. But I always say like a lot of studies show that, for example, vitamin D helps with fatigue, energy, and can even has been shown like based on studies to help with clinically aid with depression.
Mhm.
And there's also magnesium, specifically magnesium glycinate, which I tend to recommend to people if they're able to take it. Again, I always tell them like make sure you have done blood work and or let me know what medications you're on so I can know exactly if this is suitable or not for you.
Mhm.
But that magnesium tends to really help with sleep, for example, and has been shown as well based on studies again with sleep or helps with anxiety.
Okay, good to know.
Mhm.
Again, I think a lot of that social media hype comes from people misinterpreting studies, which then you can come and clarify.
Exactly. And like I said, like, they say it kind of grinds my gears. That's something I'm like, hey, like, are you even like certified or educated in it, like to speak about certain topics like this? Because it's really unregulated, especially like I said on TikTok or Instagram,
Mhm.
where someone could just go on and say, take this peptide and your skin will clear, or you'll get like your muscle mass will improve, which is it's something.
Yeah, this is a good time to plug your social media because Eamon has a big Instagram following, right?
Yeah.
So, what did I say? You're like the Dr. Oz of Instagram
Yeah,
now. So, yeah, when you want accurate information with studies that
exactly.
actually are valid, then
So that's what I do, right? Like
yeah.
on whether it's on TikTok or Instagram.
Okay.
I like I said, I debunk certain things, and I just make sure that people actually understand what they're taking, and just general trends. I like to get on that and say this is what it actually is versus what someone told you for hype.
Yeah, very good information. So, also with the rise of AI and
Mhm.
digital health tools, how do you see pharmacy evolving over the next decade?
I'm a big fan of AI,
Hmm.
to be quite honest. I think it's great and it's the way it's evolving really, really, not only in pharmacy, but it really helps us in every aspect just to kind of make life easier. But in terms of pharmacy, I think it's great because I feel like it's gonna kind of help us with the technical aspect of pharmacy, whether it's through packaging prescriptions or like data entry, for example, from prescriptions, which will allow pharmacists to kind of focus on what we really studied for. So the clinical aspect. It'll give us some more time to really focus on, for example, like I said, point of care testing to test for diabetes, to test for cholesterol levels, blood pressure. We can really spend time with patients, basically, like I said, to help them with exactly what we studied for and to really optimize like their health. Because of the free time that the evolution of AI is going to give us.
Amazing. Yeah, it's a way to connect everybody a little bit.
Exactly.
Yeah, all the different prescriptions and health information that someone may have.
Exactly, and just optimize the workflow, like I
Hmm.
said.
Okay, makes sense. Okay, what's one piece of advice you would give healthcare professionals about staying relevant and continuing to grow throughout their careers?
It's a good question. I'd honestly stay curious.
Mm,
I think curiosity it's what got me into pharmacy anyways, it's just the wanting to know more and more. So I think just being curious and staying up to date with whether it's scientific journals or new medicate because there's always new medication that comes out all the time because they always find new breakthroughs in conditions and what's going to help a condition. So there's always new meds. So I think just staying relevant and as well as staying connected. So between, obviously, a circle of care, but whether it's between a pharmacist and a nurse, pharmacist and a doctor, or nurse and doctor, um, staying connected, because there's always someone who has a new piece of information that can be relevant to you, whether it's on your shift or when you're talking to a patient. So that's the most important thing, I'd say.
Mhm. Is there anyone that has changed your life perspective or direction
Are you referring to pharmacist or generally?
in general? Yeah.
I mean, I get a lot of motivation from my father, of course, just to not give up and to always, life can always be hard. We always go through obstacles, whether it's, I'm not generally talking about pharmacy, just generally in life.
Hmm.
And, my father always taught me to just always keep moving and ignore the background noise, as I would say. And obviously, my wife is really helpful in terms of just giving me that little push
Hmm.
to always get to like that next level, which I always try to attain. But yeah.
Both good advice. Yeah,
Yeah,
because you got your license at 23, right? Which is relatively young for a
exactly.
pharmacist.
So a little background is I studied in England with two of my friends. We moved from Ottawa to go study abroad, and it was a big move uh, to go study for 4 years in a foreign country where I didn't know anyone. So that really helped build my character. Whether it was just starting to cook or really keeping my apartment clean. So all of these things really shaped me up into the person I became today.
Awesome. Yeah, thank you. And where can listeners connect and follow your educational content to learn more about your work?
Hmm. Sorry, what was that?
Where can listeners connect to you and follow your work and educational content?
So, like you said, I'm on TikTok and Instagram, and I also practice in community pharmacy. So whether someone wants to come see me in person or shoot me a message, I'd love to connect as well. But that's mostly where I am on Instagram and TikTok.
Sounds great. We'll link your
I will for
descriptions and
sure.
your, yeah, what is it called? Your
Uh,
Instagram handles. We'll link the handles
yeah.
down below. Thank you so much for being here and
Yeah.
giving your
Thank you for
insight.
having me. It's been a pleasure.